Well, good morning, everyone. I'm Mark Houston. I think I've met quite a few of you here at one time or another. Welcome back. You are our first class, very select group of folks that are going into the advanced cardiovascular module. And this is the first of its kind. It's the only module ever to be certified by a medical school for certification. And when you get through with this, and it's 96 hours of certification, you will get a certificate from the University of South Florida at Tampa that you've achieved a total new level of cardiovascular training that no one else will have. It's 4 modules, 16A, B, C, and D. Each module is 24 hours. And you've got me for the next 24 hours. We have an incredible lineup of faculty, though, and hopefully the entire module will be coming out to you very shortly, if it hadn't already, about the other speakers and topics. But we will be covering literally everything in integrative cardiovascular medicine you can think of. Cutting-edge technologies, cutting-edge information, functional and metabolic medicine. The beauty of the program is, because we've allotted a large amount of time to each topic, is the format will be more relaxed, more time for discussion and interaction. So you will see a very different type of, at least for me, lecture didactic format the next 2 to 3 days. And what I plan to do is present a bit of information that has maybe a common theme, and we're going to pause. We're going to take some questions, consolidate our information, our thought processes, make sure everybody's got the concepts. Because as we move on with this, if you don't have the basic foundation, it's very difficult to move to the next level. But I will tell you this, today to me is one of the most exciting days, because we really take the foundational basics of cardiovascular medicine that is so applicable to everything else in this course for the rest of the time, and that's vascular biology. And if you understand vascular biology, you will understand vascular medicine. And you're going to see connections today immediately looking at biochemical reactions, nutritional biochemistry that tie directly into a nutraceutical or nutrition or a drug or something that you know about that you can go into your practice Monday morning and start applying. So even though this may sound like it's really basic stuff, and it is basic, and it's very complicated. I'm not going to smooth you over and say it's as easy stuff. It is not easy, but I'm going to try to make it easy for you. But what you'll find is learning this now is not only applicable to cardiovascular medicine, but it will actually take you into the basic concepts of every other module you've taken, because the concepts are very similar. For any of you that came in late, there's some handouts here on the front if you want to grab your book. 2 other announcements. There are 4 books up here that are, they're suggested reading. They're obviously not required. But for those of you that want to dig into this a little bit more, have good reference material, the books are up here. You can take a look at them. But one of the companies, it's on the yellow sheet, is actually giving away free for you guys in Module 16A the What Your Doctor Doesn't Tell You About Hypertension book. All you got to do is go by the booth at break or lunch and pick up the book. Just tell them you're in Module 16A with me. Bring it back. I'll sign it for you, and it's free. And they also have the black book on hypertension, which is a great reference material, and I think it's 30% off for you guys here at the conference. So any of those you want, go ahead and do it. As I mentioned, Module 16A is now officially recognized by the University of Florida's Tampa, South Florida, for the certification program. It's going online, and I think some information at the front desk. You can check with them about the certification process if you haven't already gotten that. All right? So just for my information, I want to know who I'm speaking to, what kind of training you've got. How many of you in here are cardiologists? 2 cardiologists, all right. Internal medicine. Okay, family practice, good. Osteopath and DC. All right, so Cardiology, internal medicine, family practice, and osteopathy. Is that covered? And emergency medicine. Did I miss anybody? OBGYN. Any others I missed? We're glad to have all of you, and this will be applicable to everything you're going to do in your practice, so let's get started. There'll be two parts of vascular biology, and this is kind of the spectrum we're going to talk about. We'll get into specifics of the blood vessel structure. We'll look at endothelial function and dysfunction, what the different mediators are for causing vascular disease. A lot of information on the RAS system that's important we'll discuss. Then we'll take all that and apply it to how you get atherosclerosis and how you define it, but also how you measure it. New treatments, the basic foundational models of cardiovascular disease, which are oxidative stress, inflammation, and autoimmune dysfunction. Then we'll look at arterial compliance and how you measure that. Talk about some new concepts in blood pressure management as well as measurement that are more accurate than what we're doing right now. Then we'll look at an integrative approach to nutrition, nutraceutical supplements, drug classes, and how that ties in to the vascular biology, not just to lowering the blood pressure, really a new concept in how to manage cardiovascular disease. So all of you know this is the #1 cause of death in the world, and in the United States it's the #1 cause of death, and stroke is number 4. We spend probably in the excess of $60 to $80 billion a year just on cardiovascular disease alone. The idea of learning how to prevent CVD then will have a huge impact on your ability to reduce death. Now this is a very simple but often misunderstood concept. That is, vascular disease is really a balance between the injury that's imposed from very different insults and the ability to repair the system. What we typically concentrate on in traditional cardiovascular medicine is the insults and the injury, but we really don't concentrate on the repair mechanisms. So we'll talk a lot about how to do that. And this is a concept that I coined in 2002, and I'm going to explain to you exactly what this means. This is probably the most important concept now in cardiovascular medicine. The blood vessel has a finite number of responses to an infinite number of insults. Now what I mean by that is, we've traditionally said there's 5 major risk factors: hypertension, dyslipidemia, diabetes, obesity, and smoking. Well, that's all fine and good, but there's not just 5. There's probably 1,000 risk factors, risk mediators, downstream things. And that's what we're going to learn, how to interrupt those different mediators and risk factors, way beyond what we're doing in medicine, because we've reached a point in cardiovascular disease that if we treat only the top 5, we're still going to have what's called a 50% coronary heart disease gap, meaning that people are still having heart attacks doing everything we can do at optimal levels. So we're missing something, aren't we? So I'm going to show you what we're missing. The finite responses are very interesting, and this really applies not just to cardiovascular disease, but every other disease. Once you set off the insult to the endothelium, it doesn't care what the insult was. It could care less. It's going to react the same way because all it's doing is trying to defend your body against whatever the insult is. So its reaction is standardized. And there's only 3 things it can do. It gets inflamed, oxidative stress, or autoimmune dysfunction. That's it. Those are the only 3 reactions. And those 3 reactions result in endothelial dysfunction, vascular and cardiac smooth muscle defects. So looking at it very simplistically, this is what happens. You have now what we would consider at least 1,000 insults, or maybe more than that. And obviously, we're going to pick the top ones to talk about that you can actually measure in your practice. And they're really in 2 basic categories. You have the biomechanical insults. That's the hemodynamic influences. That's blood pressure, blood flow, pulse pressure, laminar flow, changes in oscillation in the arteries. all hemodynamic stuff. And we're going to learn the new technologies and how that's measured, what it means, how it causes vascular disease. And then everything else falls into biochemical. Now, you can list anything you want to over here. Humoral, microbial, any infection, any nutritional problem, metabolic diseases, sterile antigens. That's just what's released in your body from typical cell breakdown that circulates. It's basically dust particles. It's vascular junk in your arteries.